Some Victorians are having to wait 4 years to see a dentist. The Australian Dental Association says waiting lists are blowing out because funding for dental care has flatlined while the population grows. It says some adults and children have had so much pain they've had to go to hospitals instead. Iskander Razak has more.
It's the sound many fear. But it's what thousands of Victorians need. The average Victorian is waiting almost 20 months for public dental care. That's a 67% increase in the last 3 years, and large swathes are waiting more than 2 years. It's particularly bad in the East Grampians and Central Gippsland, but it's no better in the state's capital either. Few areas in Melbourne have wait times under 2 years, and in parts of the north, it stretches to 32 months.
It's painful. It's painful.
Sash Ali languished for 2 years and says his problems compounded into headaches, migraines and other pains while waiting.
It impacts your psyche. It impacts the way you interact with people.
And for many, it's even worse. For some patients, the decay gets so bad they end up in emergency wards.
The pain becomes so significant, or the amount of swelling becomes so significant that they need to seek treatment in a hospital.
The association wants a 5-year plan to double the patients seen from 400,000 to 800,000. The Commonwealth says the states are responsible for managing waiting times, but the Victorian government says the federal government needs to take charge.
A Commonwealth-funded dental program, one that was cancelled shamefully by John Howard way back in 1996. We cannot pretend to be the federal government and the state government. We need a national approach to this.
But those in need just want action.
The state is there to serve the people, you know what? Don't make people suffer. Put funding into it or do whatever to reduce the waiting period. That will be nice.
Because the longer dental problems linger, the more the rot sets in. Iskander Razak, ABC News.